You've seen it a million times in any hospital setting. It's just a simple piece of plastic tubing, right? A life-saving tool, no doubt. But what if I told you this humble urinary catheter has a really dark side? That it's actually a battlefield where a hidden war is raging inside millions of patients every single year? Let's get into it. I mean, it just doesn't seem to add up, does it? Here you have a device that's designed to help people, but at the same time, it creates this perfect superhighway for bacteria to march right past the body's natural defenses. So the real question we have to ask is, how on earth does something so common become one of medicine's biggest dangers? And when we talk about the scale of the problem, wow, just look at this number, 40%. That's the estimated slice of all hospital-acquired infections that are linked back to urinary catheters. Think about that for a second. That's 4 out of every 10 infections someone picks up in a hospital, all coming from this one single device. It's just massive. All right, so to really get a handle on this hidden enemy, we need to do a proper threat assessment. Let's break down just how common and, how unbelievably expensive these infections really are. So, if you look at this, you'll see that at any given moment, only about, say, 12 to 16% of hospital patients actually have a catheter. And you might think, okay, that's not a huge slice of the pie. But, and this is a big but, when you factor in the millions of people who are hospitalized every year, that seemingly small slice suddenly becomes this enormous population of people who are at risk day in and day out. And when those infections do happen, oh man, the cost is just immense. This makes it painfully clear. We're talking over $450 million every year just in direct treatment costs in the US alone. And in the UK, nearly 100 million pounds. This isn't just some small medical issue. It's a massive economic black hole for healthcare systems. But money is one thing. The real cost, the one that truly matters, is the human one. Get this, up to 13,000 deaths every single year in the US alone are tied back to these infections. So let's be crystal clear about this. This is not a minor complication. It is a leading cause of life-threatening sepsis. And it all starts with a simple plastic tube.
So, how do these infections get so bad so fast? To figure that out, we've got to zoom way in, down to the microscopic level. We need to see the bacteria's #1 strategy in action, building an almost impenetrable fortress called a biofilm.
Okay, and here's the crazy part. The whole thing doesn't even start with the bacteria. It starts with us. It's our own body's reaction. Within just a few minutes of that catheter going in, proteins from our own plasma, stuff like fibrinogen, start coating the plastic. It's like we're unintentionally rolling out the red carpet, creating the perfect, sticky welcome mat for bacteria to grab onto. And from that point on, it's basically a construction project in fast forward. Our body lays the foundation, right? Then the first bacterial colonists show up and use these specialized little hooks to latch on. After that, they start oozing out this protective slime. It's a gross mix of sugars, proteins, and DNA that acts like concrete, building up the walls of their fortress. And once that fortress is complete, it becomes a nearly impenetrable shield that antibiotics just can't get through.
And we're not just talking about one kind of bacteria here.
No. This is a whole rogues gallery of specialized bad guys. You've got Proteus mirabilis, which uses an enzyme to form these hard, sharp crystals that can literally block the catheter. Then there's uropathogenic E. coli, which uses these tiny little grappling hooks to invade and hide inside our own bladder cells. And then you have others, like Enterococcus and Staph aureus, that have evolved these custom-made grippers just to latch on to that protein coating our body helpfully provided. I mean, they are just ruthlessly efficient. But here's a twist. The bacteria aren't the only ones doing the damage. Believe it or not, our own body's defense system can be just as destructive. Let's take a look at what happens when the immune system declares all-out war. So, the second our body detects this invasion, it doesn't mess around. It unleashes this absolutely overwhelming inflammatory assault. But, and here's the problem, in its rage to wipe out the bacteria, the immune system ends up causing devastating collateral damage. We're talking massive friendly fire incidents that just wreck our own healthy tissues.
Now, a key player in all this chaos is a molecular weapon system called the NLRP3 inflammasome. The easiest way to think about it is like a 2-key launch system for a missile. First, you need signal 1, This is the priming step. Bacteria are detected, the alarm bells go off, and the body starts building all the components for this powerful weapon. But it doesn't fire just yet. For that, you need signal 2, a second specific trigger like a toxin from the bacteria. That's what assembles the weapon and fires it, unleashing a massive inflammatory storm.
And one of the most dramatic results of this is a process called pyroptosis. Now, this isn't your normal quiet cell death. Oh no. This is a violent, explosive self-destruct sequence. The cell literally blows itself to bits to try and kill any bacteria hiding inside. It's an effective tactic, for sure, but it's absolutely brutal, and it releases this flood of inflammatory signals that causes even more damage to all the healthy tissue nearby.
Okay, so you've got this microscopic fortress on one side and our own body's violent response on the other. So how in the world do we fight back? Well, the modern approach isn't really about finding stronger drugs anymore. It's all about a smarter strategy. This is the counteroffensive. And the absolute cornerstone of this entire new strategy is captured perfectly right here. The paramount rule is you do not treat bacteria in the urine if there are no symptoms. We call that asymptomatic bacteriuria. For decades, the gut reaction was to throw antibiotics at any positive urine test. But now we know that all that does is breed antibiotic-resistant superbugs, and it doesn't even prevent the real infections from happening later. So instead of just constantly reacting to infections after they happen, the focus now is squarely on prevention. And it's all summed up in these 4 Ds. First up, the decision. Is this catheter even necessary in the first place? Second, deployment. It has to be inserted with a perfectly sterile technique, no exceptions. Third is duration. You have to maintain that closed drainage system, keep it clean, and finally, and maybe most importantly, discontinuation. Get that thing out the absolute second it's no longer needed.
Now, what if an infection does happen and it has symptoms? When treatment is unavoidable, the modern game plan is all about precision. You don't just blast it with everything you've got. First, you assess how severe it is and what the patient's risk is for drug resistance. Then, you use the narrowest, most targeted antibiotic you possibly can. The goal is always to get the patient off of IV meds and onto oral pills as fast as possible, and to use shorter treatment courses. We're typically talking just 7 days now, to cut down on side effects and resistance.
So when you boil it all down, what's the real takeaway here? The best weapon we have in this fight against one of healthcare's biggest threats? It isn't some new, fancy antibiotic. It's actually a much smarter, simpler question. A question that every single doctor and nurse has to ask for every patient every single day. Does this catheter really need to be here today? That simple question, that's our most powerful weapon.